So let's talk treatment. When developing your list of treatment options, consider what your loved one is most likely to accept. Add in what you feel is needed if that is different, and always include some self-help options like Alcoholics Anonymous, Rational Recovery, Smart Recovery, Life Ring, Secular Recovery, Secular Organization for Sobriety, or Women for Sobriety. If you've looked into treatment before, you know that it's confusing, that it can be difficult to access, and that it is without guarantee. The confusion comes from the different and often contradictory philosophies about what works, with most of the country's programs following the principles of AA's 12 steps, and a smaller number following more scientifically derived approaches, such as community reinforcement approach or cognitive behavior therapy. Treatment can be hard to access in a timely way because of insurance limitations, wait lists for public treatment, and widely differing criteria for admission to some programs. Out-of-pocket costs for treatment are a huge barrier for many. And yes, there are no guarantees that anything your loved one does is going to work. In fact, few programs follow their clients out of treatment to collect information about how they did after discharge. Which type of treatment is best for your loved one depends on several factors. First off, what is your loved one willing to do? You may think inpatient treatment followed by a halfway house is best, and we might agree with you. But if your loved one refuses to take time from their job, then treatment in the community on an outpatient basis may be the best we can hope for now. If this is the case, we suggest you talk about an inpatient program as an option for the future should treatment in the community fail. Can you get a verbal agreement from your loved one that if they should falter with outpatient care, they will consider more intensive levels of care? This isn't binding, of course, but at least the conversation and agreement has been had. Choosing a treatment philosophy depends on what may have worked before, or perhaps your loved one's stated dislike for certain programs. For instance, some people will point to the God thing in AA as a barrier. In my experience, there is a difference between someone who has never been exposed to AA, who brings up the God thing as an example, and someone who has spent time in AA meetings or AA-type programs and still has a problem with AA. Do not rule out AA if your loved one has no first-hand experience. There is increasing scientific study that shows AA works to maintain sobriety. As you may already be aware, getting clean and sober is a lot easier than staying clean and sober. Since most programming in this country follows the philosophy of AA, these programs usually require that clients attend meetings while in treatment. For those who simply have knee-jerk reactions against AA, this extended period of attendance at AA meetings can serve to turn around someone's negative thinking about AA. Scientifically derived approaches are those that include medication like Camprol or naltrexone or Antabuse, Suboxone and Methadone, and the psychological approaches based on theories of behavioralism or cognitive behavioralism, those like community reinforcement approach, dialectical behavioral therapy, cognitive behavioral therapy, or acceptance and commitment therapy. All of those are in the supplement. The line between these scientifically derived approaches and AA is not as rigid as many of its practitioners claim. For instance, there are people who take medications that support sobriety or who see a cognitive behavioral therapist who also attend AA meetings.